thing, that's a very simple thing, but sometimes it becomes very complicated. Okay, so if this is here, there is the nose, right? So, and this is your field of vision. This is your field of vision for the right and the left eye. Okay, let's make it into two halves. Let's make your field of vision. So whatever I am seeing, suppose I close my one eye. So how much field I am looking at? How much vision I am looking? So this is one vision of the right eye. This is the vision of the left eye. So towards the nose, so this center is the nose. So towards the nose, this is called nasal vision. Nasal vision, and this is nasal vision, and this is temporal vision. Temporal means towards the temporal bone or temporal lobe. This is the temporal vision. Temporal vision. Okay. So what I'm trying to say here, if I close my one eye, the right eye, I'm seeing this much of the field of vision. This is my field, which I can see this much. So if I make it into two halves, so this half towards the nose is called nasal vision. Outside vision is called temporal vision. This is the temporal lobe, okay, temporal bone. So outside is the temporal vision. So nasal vision, temporal vision for the right eye. Similarly, if I close my right eye and the left eye, how much field I can see this much of the circle. And if I make it two halves, so towards the nose, this is called nasal vision, and the outside portion is called temporal vision. Okay, if you're confused or don't understand, just switch on your mic and ask me. Okay, so nasal vision, temporal vision for the left eye, nasal vision, temporal vision for the right eye. So this is the nose, you can say this is the center. Okay, here there is the, I'm just making, this is the nose. Okay, so nasal vision, temporal vision. So this is our field of vision, right? Now you can imagine this is the optic nerve. This is also optic nerve from two sides of the eyeball. Okay. Now this is toward the temporal side. Okay, this is temporal fibers. This is the optic nerve. We have divided into temporal fibers, and this is towards the nose. So this is nasal fibers. Okay. Similarly, this is towards the nose. These are the nasal fibers of the right eye. This is the temporal fibers of right eye. Okay. Now coming to the point. Okay. Suppose you stand here. Suppose you are standing here. Suppose you are standing here. So you cannot, if you are standing here, so this nerve, look, the eyeball, the anatomy of the eyeball is circular, right? It's circular here. So this nasal fibers of the right nasal fibers, okay, right nasal fibers, it cannot catch an image from this side. Okay, if you stand here, if I give you a chair, if you stand here and behind there is a wall here, which direction you can look? You can look in this direction. You can look in this direction. Okay. So what I'm trying to say here, the nasal fibers, they catch the temporal field, and the temporal fibers they take the nasal field. Okay. So means if I take a scissor and cut your nasal fibers of the optic nerve of the right eye, then you cannot see the temporal vision. Okay, then this part you cannot see from the right eye. If you close your left eye, then this part will be dark. Okay, because they crisscross. So nasal fibers, they take the temporal vision. Temporal fibers, they take the nasal fibers. Similarly here, nasal fibers, they take this. So if you are standing here, you can look this side. You cannot look this side because there is the anatomy of the eyeball. This is circular, right? Okay. So nasal fibers here also. So nasal fibers are carried by the temporal fibers. Temporal vision is carried by the nasal fibers for both eyes. Okay, they are opposite. Right? Don't be confused. And if you are confused, switch on your mic and stop me in the middle. Okay. So optic nerve has two fibers. One from the temporal fibers, nasal fibers. Nasal fibers, temporal fibers. Those fibers towards the nose are called nasal fibers. Okay. Now this tract is going to the occipital lobe. We all know that our visual cortex is behind at the occipital lobe, just in the calcarine fissure. We know these things. Now let's move with this tract. Okay, let's move with this tract. So as this tract moves, okay, now this is the optic nerve. Remember, this is the optic nerve with nasal fibers and temporal fibers, nasal fibers and temporal. So as it moves, now I'm talking about the nasal fibers. These nasal fibers, as it moves, nasal fibers, they cross to opposite side. Okay, they cross to opposite sides. Nasal fibers, they cross to opposite side. Okay, and the temporal fibers, So I'm continuing with this red one. So okay. So the temporal fibers, they don't cross to the opposite side. They run in the same side. They run in the same side. Okay. Okay. So here there is a crossing point. Optic nerve means the nasal fibers of both the eyes, they cross here. So this crossing point is called optic chiasma. Okay. This landmark is called optic chiasma. Optic chiasma. Okay. So this point is called optic chiasma. So what is this optic chiasma? The optic chiasma is the point where the nasal fibers of the optic nerve, they are crossing. The point where they cross. This point is called optic chiasma. Okay, if you look at the fibers, temporal fibers, they just go in the same direction. But the nasal fibers from the right eye, they are going to the left side. Left nasal fibers, they are going to the right side. Okay, so I hope it is clear now. Now from where it goes? From here, it terminates. So this one here terminates where? In the thalamus. So this is the thalamus. They will terminate in the thalamus. Where in the thalamus? They will terminate in the lateral geniculate body. Lateral geniculate nucleus of thalamus. In addition of that, okay, just in few new books it's written that is dorsal lateral geniculate nuclei of thalamus. So even if you write lateral geniculate body, because in old books it is mentioned as lateral geniculate body, it's okay. So lateral geniculate body or lateral geniculate nuclei of thalamus. So these fibers, they terminate there. Okay. From here, from the thalamus here, these fibers will go where? They will go to the occipital lobe. So this is the occipital lobe. Okay. So these fibers will be going to the occipital lobe. Okay, they will be going to occipital lobe. Okay, so what are the pathway of the visual tract? Okay, so these are called nasal fibers, temporal fibers. Okay, so this is the optic nerve, right? Then optic chiasma. Now this part up to the thalamus, this is called optic tract. This is called optic tract. Don't be confused. Huh? This is called optic tract. This is optic nerve. Optic chiasma. So optic nerve, optic chiasma, optic tract. Then dorsolateral or dorsal lateral geniculate nuclei of thalamus. And this part after the thalamus, up to the occipital cortex or the visual cortex, this is called optic radiation. Remember that. Optic radiation. Because it spreads. Okay, it spreads. Okay. This is called optic radiation, and in new books it is also called this optic radiation is also called a geniculocalcarine. Because it starts from the geniculo, the part of the thalamus, and ends in the calcarine fissure of the occipital lobe. So in some books it is also called a geniculocalcarine tract. Which part is called geniculocalcarine tract? The optic radiation. Okay. Now, I'm not trying to confuse. I'm just trying to make it simple. Optic fibers, nasal fibers, temporal fibers, optic nerve, optic chiasma, optic tract, lateral geniculate nucleus or lateral geniculate body, optic radiation, and occipital lobe, visual cortex. Okay. So do you have any questions? You can ask me now. You want me to recap somewhere? Please switch on your mic. This is the last class. Okay. You switch on your mic and you ask me if you're confused anywhere. Because now I'm going to the disease part. If you don't understand this part, you cannot understand the disease part. Please.
Sir, can you repeat optic radiation?
Okay. So optic radiation is actually don't be confused with optic radiation. Suppose this is the thalamus. Okay. Now the nerve fibers. Now it's looking so plain. You see, it was just one and one. Nasal fibers, temporal. But after the thalamus, the fibers they are spread. They spread like a fanning of the fibers. So that's why it's called optic radiation. From thalamus the whole thing is spread up. Okay, there are short fibers and it's like this anatomically. So we call it optic radiation. Okay, there are short fibers, plenty of short fibers. Okay, that's why optic radiation. So optic radiation starts from the thalamus up to the visual cortex. Where is the visual cortex located? Visual cortex is located in the occipital lobe. Okay. So if you see the occipital lobe here, this part is occipital lobe, and here is the calcarine fissure. Just here above the calcarine fissure, there is the occipital lobe. Okay. Oh, sorry, just above the calcarine fissure, this is the visual cortex. So if you see here, if I just make it like this, so from the eyes it goes, so here right at the above the pituitary gland, okay, this is pituitary gland, this is the pituitary gland. So right above the pituitary gland there is the optic chiasma point. So which is the landmark. Below the optic chiasma there is the pituitary gland, if you remember the pituitary gland. That's why sometimes when there is a pituitary gland tumor, it affects the optic chiasma. Okay, when there is a pituitary gland tumor, it affects the optic chiasma. So this optic chiasma is affected. Means what? Nasal fibers are affected. Nasal fibers are affected when there is a pituitary tumor, when it is extending upwards. It damages the optic chiasma. Okay, optic chiasma means nasal fibers are affected. Nasal fibers are affected means temporal visions are affected. So when there is a pituitary tumor extending upwards to the optic chiasma, this temporal vision is affected. Means a person can see only the central side, he cannot see the outside portion of his vision. So when this is my vision, this is my circle field of vision. So when there is a pituitary tumor extending up to the optic chiasma, then I can see only clearly this much. So this part will be dark. Why? Because its nasal fibers are affected. So when nasal fibers are affected, temporal vision will be affected, both sides. Right? So when temporal fibers are affected means you can see this part. You cannot see this part and this part. So this part is lost. That's why you need to know this anatomy. That's why it's so important. When a person comes with a tumor and he says that, or sometimes he just comes for an eye checkup, you say that I can see this part very clear, but this sides, this side and this sides are not blurred. Then what you will think? You will think of this point. So either there is a damage here, there is a head injury, trauma, history of trauma, or there is some tumor in the, because below the optic chiasma there is a pituitary gland, which is the master of endocrine glands. So when there is a tumor in pituitary glands, it just affects the optic chiasma. That's why it's so important and so valuable. Okay. Okay. Coming back to your question, Faril, optic radiations are just fanning out of this, some axons fanning out of this thalamus. It goes like this. Okay. So we call this optic radiation. All right. So that is anatomically it's. Because so much of nerves coming out of thalamus going to the occipital lobe, so we call it optic radiation. Okay. So what are the parts of visual tract? Now when it comes in the exam, you don't try to write any words, just draw the diagram. Okay. Okay. So here parts of visual tract: nasal fibers, temporal fibers. Nasal fibers, temporal fibers, optic nerve. Then nasal fibers cross, temporal fibers remains on the same side. So this is optic fibers. Optic nerve, optic chiasma, lateral geniculate nucleus, its synapse here, it ends up here, terminates here. So optic nerve ends up in the dorsal lateral geniculate nuclei of thalamus. Or in all books it is just written as LGB, means lateral geniculate body. You can write whatever you want. Okay, don't worry for that. So after the thalamus, it goes to the visual cortex in the occipital lobe, just in the near to the calcarine fissure of the occipital lobe. So this is your visual tract. Okay, do you have any questions? Any other questions you can ask me now. Okay, this, because once I go to the disease, it will be very difficult. Right? So any have a question?
No, sir.
Okay, thank you very much. Alright, now let's go to the visual lesions. Okay. So what are the visual lesions? What can happen? So first thing is that, number one, if there is any lesion here, okay, if there is any lesion here, number one, there is a lesion here, that the optic nerve is being damaged. When there is an optic nerve, cutting of the optic nerve or shivering of the optic nerve, trauma of the optic nerve, anything, any tumor, anything. So when optic nerve is damaged, so this is a left eye. So what will happen? This eye will close, means this will be blind. So one eye is blind when optic nerve is damaged. So this part, this is called left. This is because of left side. I'm taking the example of left side. So this is called left anopia, means blindness. One eye. Anopia means one eye. Okay. So anopia means blindness. Okay. This is called left anopia. Okay. So when there is a damage in the optic nerve. So this is number one situation. So number two situation, as I told you, number two situation when there is a optic chiasma lesion. So most common cause of optic chiasma lesion is when there is a pituitary gland tumor extending up to the optic chiasma point. So here the nasal fibers are damaged. So as I told you, nasal fibers are towards the nose. This is the nasal fibers. They are taking the temporal vision. They are taking the temporal vision. So the temporal field will be lost. So he can see only this much. So he can see only this center part. He can only see center part. And peripheral vision, outside vision is be lost. Okay. So what will we call this defect? This is number two defect. Is called homonymous. Oh, sorry, bitemporal. Where's the duster? Excuse me. This is called bitemporal because both the temporal vision is lost. So number two is bitemporal hemianopia. So one more question comes, when is the bitemporal anopia is found? Hemianopia. Hemi means half. So bitemporal hemianopia is found in number two lesion, whenever there is a lesion in optic chiasma. Optic chiasma lesions, both the temporal visions are cut. Bitemporal. Temporal visions are lost. Only the nasal field is there. Means he can see clearly in the center, but this part will be dark for him. So bitemporal hemianopia, this is called. Coming to optic tract. So if there is a number three lesions, if there is a damage here. So let's take the example, the right optic tract. Means this temporal fibers of the right eye is damaged. Nasal fibers of left eye is damaged. Okay. So what will be the problem? So let's go one by one. So, okay. So number three lesion is when there is a optic tract lesion. Optic tract, when there is a damage in the optic tract. Let's take the example of the right side. Okay. So right side optic tract lesion. So which fibers is lost? This is the temporal fibers of right eye. So temporal fibers of right eye is catching the nasal vision. Okay. Temporal fibers of the right eye is lost. So this part will be blind. Right. Temporal fibers of the right eye is lost. So his right nasal vision will be lost. This part will be blind. And nasal fibers of the left eye is lost. So nasal fibers of the left eye is lost. So nasal fibers means this temporal vision. So this part will be lost. So he can see clearly this part and he can see clearly this part, but this vision and this vision is lost when there is the right side. Okay. If you are confused, please ask me again. So if there is an optic tract lesion on the right side, then right temporal fibers are lost. So right temporal fibers means nasal vision is lost, right nasal vision, and left optic nerve, which because it crosses the chiasma, so left optic nerve is lost, means left temporal vision. Okay. So how it will look like? So if this part is clear and this part is clear, so he cannot see this much and he cannot see this much. So this is called homonymous right, is because the lesion is on the right side. So number three lesion is right homonymous hemianopia. Hemi means half, hemianopia. Okay. So this is a number three lesions when there is a right homonymous hemianopia. Okay. So I'm going to the number four, in optic radiations. Now it's very rare because the fibers are very extended, so it cannot damage all the nerve fibers. So only few fibers will be damaged if there is any tumor, because the fibers are extended here. So it's very impossible that the whole of the fibers will be damaged. So when there is a damage in the optic radiation, number four, so what will be vision? So vision will be, we call that, okay, wait, let me make it clear. So if there is a fourth optic radiation, number 4, right side. So when there is a lesion in the optic radiation is receiving same like optic nerve, right? It's receiving same like optic tract. So lesion will be almost same, but not fully, because the radiations are spreaded. So just like number 3, because it consists of optic nerve from the temporal vision, so this much will be lost, the superior part, okay, half, okay, and it also consists of these fibers, nasal fibers, which is here, this much will be lost. Because all of the optic radiations can, just few of the fibers are damaged, so this, we call it the superior, just a little bit portion, this quadrant, one quadrant. So superior, right side, yes, right side superior quadrant anopia. Anopia means blindness. So right superior quadrant anopia. So these are the 4 lesions, visual tract lesions. Okay, going from front to back, when there is an optic nerve separation, there is anopia. One eye is blind, left or right, whatever it is. When there is optic chiasma, then it will be bitemporal hemianopia. Both the temporal fields are lost. And when number 3, when there will be, so where is the number 3? When there is the optic tract is lost, then right homonymous hemianopia. Okay, right homonymous hemianopia. And number 4, when there is optic radiation, is right superior quadrant anopia. These are the 4 visual tract lesions. In addition to that, there are just 2 more. Okay, let me go into that too also. So you know that in the last class, I told you there is in the retina, here there is the most HD vision here is there. This part is called macula. This part is called macula. It has got plenty of cones, and it is gives us the central vision. So God has given us that power that our central part is HD, is high definition, is so clear, but the peripheral is not so clear. Okay, so this is called macula. Now there are some situations where you can see sometimes this macula is damaged. So what will happen if both the maculas or one of the macula is damaged? Okay, it happens in a condition called macular degeneration. Macular degeneration. So this is most of the time this macular degeneration is an age-related condition. With increasing age, this macula, which is needed for central vision, this is your vision. So this central part is very, very clear. Okay, because of the macula. So when you look at your central part is very, very clear because of the macula. So with increasing age after crossing of 60 years, also associated, very clearly associated with smoking cases, those who smokes regularly and they aged, then there is this macula, they usually degenerates. Okay, they damage, degenerates. So with increasing macular degeneration, with increasing age, obesity, smoking, family history, then they lose the central vision. So central vision is dark. So in those people, their central vision is dark when there is a macular degeneration. Okay, this is called central scotomata. This is called central scotomata. When the macula is degenerated, and as a result, this person will complain of that my central vision is blurred. My side visions are clear. This happens. They usually find difficulty in reading, in driving, doing daily to day activities, because we need, when you look at, we need our central vision to be most clear. But they complain of this central scotomata. Okay. Then in some conditions, most of the optic nerve fibers are damaged, but the macula remains intact. There is no damage to the macula. Okay. Like in cases of glaucoma. Okay. The macula remains intact, but most of the optic nerve fibers are damaged. So what type of vision he will look when both the eyes, suppose both the eyes are affected? So he only can see the center part, but the rest of the part, it becomes totally dark. So his peripheral vision is lost, but his center is okay because macula is not damaged. Most of the cases in glaucoma. So when you look, your center is clear, but peripheral is dark. So this is called macula sparing, because macula is spared. Macula is sparing. Okay, this is typically found in cases of glaucoma because of pressure. In high intraocular pressure, optic nerve is damaged, but macula is not damaged during in cases of glaucoma. So we call this, they have a tunnel vision. We call this as a tunnel vision. They can see things like a tunnel, but outside part of the world is dark, but they can see everything in the center. Okay, so this is called tunnel vision or macular sparing. So these are the 6 visual